Hey everyone, Dr. Bodle here. Now, many times when we're struggling with thyroid symptoms and Hashimoto's, people think, if I'm having thyroid problems, then I need to get thyroid medication. But even though this line of thinking makes total and complete sense, for many people, when they start taking thyroid medication, they either don't feel better or they feel worse. So today we're going to talk about why medication isn't always the best fit for Hashimoto's, because I know a lot of times these things aren't well explained and it can be confusing to us as patients who continue to suffer with these symptoms. And remember, if you've been liking the videos and want to continue to learn about natural strategies to support your Hashimoto's and hypothyroidism, give this video a thumbs up, subscribe to the channel, and click on the bell for notifications for new videos every Thursday. Now, as we've said in other videos, Hashimoto's and autoimmune conditions in general are not something that typically happens in an instance. Yes, there can be certain triggering events that can flare up symptoms and make things noticeably worse. And this can be something natural like going through menopause or going through a pregnancy. Or it could be something that is toxic in our environment, like being exposed to a chemical or maybe going through a surgery or having some sort of accident. But for the vast majority of people, the development of thyroid antibodies occurs years before the onset of significant symptoms, and then sometimes it can be many more years until they start to see changes in their lab values and special testing. The tricky part is that in-between time. This is the time where you have all the signs and symptoms of thyroid disease and you can feel like total crap, but the thyroid hasn't had enough damage yet to where there will be changes in those standard markers that your doctor is checking, TSH and T4, and therefore you don't qualify for officially having hypothyroidism. If you don't meet those standard qualifications and check all the boxes, then most of the time your doctor isn't going to do anything. And even worse, sometimes your doctor will not believe that you feel poorly. But the big issue is that your doctor doesn't understand Hashimoto's and they don't understand the progression that is occurring. So instead, they just say, well, we'll watch and wait, and when things get worse, well, maybe then we'll give you thyroid medication. Now, there's a couple problems with this approach. Number one, it doesn't do anything to help you. You still feel poorly, and as I said before, it could be many years before enough damage occurs where your doctor then takes action. And it might be easy for them to ignore the numbers, but we shouldn't ignore the way that you feel. And number two, the reason why you're having thyroid symptoms at this time isn't because you're deficient in T4. And therefore, you're also not deficient or in need of something like a T4 replacement, such as levothyroxine or Synthroid. The reason why you're having these symptoms is because of the development of your thyroid antibodies and the associated immune system activity. When your immune system flares up and damages your thyroid, well, anytime we damage tissue in the body, it's going to lead to inflammation. Inflammation with our thyroid tends to be systemic in nature, and when that occurs, it can block our cells' ability to bind thyroid hormone. So even though you might have enough T4, it doesn't do us any good if we can't bind it to the cell. And it can produce the same kind of symptoms as if we didn't have enough T4 in the first place. Now, as time goes on, yes, eventually there will be a time where our thyroid gland can struggle to produce adequate levels of thyroid hormone. But just like with the onset of Hashimoto's, that's not something that happens all at once. As we transition from a fully functioning gland to a gland that might need some sort of medication support for forever, there's an interim period where our brain tries to step in and help out. You see, the brain is always monitoring our bloodstream. It's looking at T4 levels, it's looking at T3 levels, and it's determining whether we need more or less based on the situation. If those hormone levels start to drop, then the way the brain tries to compensate is by increasing TSH or increasing the stimulus of our thyroid gland. Remember, TSH stands for thyroid stimulating hormone. So even though our thyroid gland is being damaged by our immune system, in the early stages, it's still going to have the capacity to respond to that increase in TSH and crank out more T4 and T3. This is what's referred to in the research as subclinical Hashimoto's hypothyroidism. TSH is elevated, but our T4 and T3 levels are normal. But again, If the only thing that helped to determine the health of our metabolism was the amount of T4 and T3 that we have, then even in this subclinical state, we would assume that someone wouldn't experience any symptoms. But as you all know, that's not necessarily the case. However, this could be the first time that your doctor acknowledges that something might be wrong. Even with the change in TSH, some doctors, depending on the standards that they subscribe to, are still going to wait. Others, however, might use this as their first sign that it's time to start taking action. Now, a lot of the time, medical approaches for chronic conditions are about matching symptoms to medications. And if you have a thyroid problem, then the answer is you must need to take thyroid medication. But as we just said, even though TSH is high, and even though as time goes on, you could have an issue with low levels of T4, that's not the case at this moment. And for other people with Hashimoto's, they could be prone to big swings in their immune system, where sometimes their TSH is elevated, sometimes it's normal, and sometimes it's low. But unfortunately, no matter the pattern of presentation, or maybe some of the other contributing factors that are going on, the application or the approach is going to be the same. So what happens if you give someone with Hashimoto's who already has enough thyroid hormone in their system more thyroid hormone? Well, for some people, the answer is not much. Their body processes the medication without too much issue, and because the problem wasn't a T4 deficiency in the first place, they don't notice any improvement in their symptoms. But for other people, piling more T4 onto a system that already has enough T4 can actually make things much worse. Since the problem is your body is being blocked from efficiently using thyroid hormone, adding more hormone to the mix can actually ramp up your metabolism in an unhealthy manner. This is where people can experience many symptoms that are more commonly associated with hyperthyroidism, and it can include things like insomnia, anxiety, sweating, internal trembling, shaking, hot flashes, hair loss, and a racing heart or heart palpitations. In fact, it's not unusual for people to know when they have too much thyroid medication because they'll say things like, "Once I got on that dosage, I wasn't able to sleep at all." And the way that I explain this to patients is by using what I think might be our third bucket analogy. Sorry for the confusion, not my intention. All three bucket analogies are still valid, they're just explaining different points, so hang with me here. If you had a flower garden, you would want to water your flowers, that way they could stay healthy and grow. If you had trillions of cells in your body, which you do, you would want to make sure that they get thyroid hormone, that way they can stay healthy and grow. So if we were going to carry water from our spigot over to our garden, it wouldn't do us much good if the path to our garden was blocked. Sure, it's great that we have the water, but if we can't actually get it to our flowers, then it's not going to help them with their health. Unfortunately, the standard approach is to not assess the blockage on the path. Rather, it's only going to be looking at the amount of water in the bucket. And if the flowers aren't getting enough water, then the thought process is, well, you must not be taking enough water over to them. But even when we look at that bucket and we see that the bucket is mostly full or close to full, we don't think of it in any other way. And we figure we have to fix the problem by putting more water in the bucket. Now we've got water all over the place, it's on our shirt, it's on our shoes, we've negatively impacted our day in the garden, we haven't gotten water to the flowers that need it, and we haven't addressed the thing that's preventing us from getting to the flowers in the first place. So if we have enough water in the bucket, or if we have enough thyroid hormone in our system, then adding more to it isn't always going to be the fix that we're told it's going to be. Thyroid problems, especially those caused by Hashimoto's, are dynamic, and what our body needs is going to change at different points in our life. Do some people need thyroid medication? Should you work with your doctor to find the right kind of thyroid medication and the right dose? Absolutely, and there's nothing wrong with that. But this needs to be done when it makes sense, and having people take medication when the numbers don't support it or when it makes them feel worse doesn't make much sense to me. Now, I know we want to be proactive and when we can, do something to help our thyroid. And I'm not suggesting that people should delay certain therapies and prolong their suffering. But medication does not address the autoimmune aspect of Hashimoto's, and at the end of the day, That's the piece that we can't forget. Now, of course, different people are going to need different types of support, and we want to figure out what's going to work best for you. But as we try to help support one another as a community, I'd love it if you could drop me a comment and let me know what's worked really well for you, and if there's been certain areas with your medication that has been a big challenge. Additionally, if some of the topics that we covered in today's video sound like you, but you're not getting the help or support that you need from your practitioner, and are interested in working with me one-on-one, either in person or virtually, then you can start that process by sending an email to contact@seattlethyroidhelp.com. And once we hear from you, my staff will reach out and help you to get scheduled for a free consultation, either in office, over the phone, or over Zoom. During our consultation, we'll talk about your health history, what your goals are, and see if we can be a good fit to work together. If I think I can help you, I'll provide some thoughts and feedback and talk about what the next steps would look like. Of course, if you have any questions, we'll make sure to answer those as well. If you're not ready for the consultation but still want to make some changes, you can check out any of my other strategy videos on the channel, or you can grab either one of my free downloads listed in the description box, one of which is the food list that I use for many of my patients with Hashimoto's, and the other is the electrolyte recommendations that I'll use for people who are following a ketogenic way of eating or a low-carb diet. But that is it for this one. I love you guys and hope you're doing well. Don't forget to like and subscribe. If you're looking for more info, you can follow me on Instagram or Facebook, and you're always welcome to reach out anytime. But my name is Dr. Bodle. I hope you guys have a great rest of your week, and I will see you in the next one.